You know, it's kind of interesting that I'm surrounded with all kinds of information on medical and what's going on in medical, and from everything from the Constitution and how it should be or should not be addressed. And I have books and books and books of research, and I have tons of stuff in the computer. And the only conclusion I can draw, it's a very overwhelming subject. And I am going to attempt to kind of put everything in context and bring it down to a half-hour presentation, which necessitates leaving some stuff out and putting some stuff in. But hopefully this presentation will give you kind of a snapshot of where we are and where we're going. Good evening, ladies and gentlemen. The purpose of the presentation you're about to see is to bring you up to date on what is going on with medical care in the United States today. We're going to discuss where we are, how we got there, where we're going, and some possible solutions. To give you a little bit of my background, I have been studying medical since 2010 when Obamacare passed. I've talked to many medical professionals, including doctors and nurses from both the United States and Canada, as well as attending medical conferences. So let's discuss medical. Let's talk about medical realities. Reality, everyone must get health care, but someone must pay for it. We always got to add that, someone must pay for it. Too many Americans equate health insurance with actual health care. Health insurance is not health care. Your insurance company may or may not pay for what your doctor recommends. Too many Americans are not aware of how the medical community is reacting to Obamacare and its aftermath. There are not enough medical professionals. That's a simple fact. The situation is getting worse, not better. Every person has their own horror story. Long waits for an appointment. Must see a nurse practitioner first. Doctor no longer in your network. Co-pays unaffordable. Doctor does not accept new patients on Medicare. Does any of this sound familiar? But one of the reasons is doctor after doctor I talk to does no longer encourages their kids to go into medicine because they no longer consider medicine a viable career option. The only real question is, how do we deal with these realities? We could be like a politician and tell you what you want to hear all the time, kicking the can down the road. Or we can be truthful. And the truth is, ladies and gentlemen, as far as medical care is concerned, this country is at a crossroads. We are either going to go to socialized medicine or personal responsibility for your own medical care. I really don't see a middle path. It's going to go one way or the other. Where are we now? One step away from socialized medicine. Congressional Democrats are pushing their universal health care agenda. The lead vehicle is Vermont Senator Bernie Sanders' Senate Bill 1804, billed as Medicare for All. H.R. 676 is very similar to Bill 1804. And here they are, ladies and gentlemen. All you have to do is go online and you can print them out for yourself. Almost all of the Democratic presidential candidates have signed on, and their numbers keep growing, including both senators from New Mexico. The bill would create a government monopoly on health care. They would outlaw all private health insurance, including Americans' job-based coverage. Impose restrictions on private medical practice, no personal freedom, no personal choice. How did we get here? 1966, Medicare. Little known fact. In order to receive Social Security, you must sign up for Medicare, Part A, hospital coverage. If beneficiaries want to opt out of Part A, they must forfeit all of their Social Security payments, including paying back any Social Security benefits received up to the time Part A was declined. Think about it, ladies and gentlemen. You pay Social Security all your life, unless you do exactly what the government says. Unless you sign up for Medicare, you lose it. 1982, Medicaid. Enrollment in Medicaid greatly expanded under Obamacare. 1997, Children's Health Insurance Program. 2010, Obamacare, which is still the law of the land. Make no mistake, ladies and gentlemen, Obamacare is still the law of the land. Just because you no longer have to pay the tax penalty doesn't mean your employer doesn't have to buy an Obamacare sanctioned health plan. Ask anybody who's only working 30 hours a week because they do not want to be considered full-time. Let's take a moment to discuss Obamacare. Now, normally when you discuss something, first thing you do is define it. This is Public Law 111148, Obamacare. This is a 4-inch binder. It's filled with sheets, front to back, printed on both sides in number 10 font. How do you define something like this? By the same token, these are our founding documents, the Declaration of Independence and the Constitution of the United States. I can hold these up with 2 fingers. The Declaration of Independence defines human rights. We hold these truths to be self-evident. Constitution gives us a roadmap to guarantee those rights. We the people, with emphasis on we the people. Did we the people, through our elected representatives, write Obamacare? Who actually wrote the health care law? Section after section of Public Law 111148 contains the wording, "The Secretary shall." This phrase appears 1,444 times. So you would think that Kathleen Sebelius, who was in front of the Senate and got confirmed as the Secretary of HHS, would have a lot to do with writing the health care law. But the reality is, Mr. Gruber, who thinks Americans are too stupid for the truth, wrote the law. So let me ask you a question. Did you see him in front of the Senate getting confirmed? Did you see his name on any ballot? No. Mr. Gruber reported to one man and one man only, Barack Obama. Simply put, Obamacare has made the average American citizen a serf. For those of you who are unfamiliar with that word, in medieval times, the serfs, or peasants, worked the land, but the royalty took most of the proceeds of their work. Today, we call that royalty the ruling class. And to give the ruling class a little bit of a name, I decided that that looks a lot like Chuck Schumer, Nancy Pelosi, and AOC. What Obamacare has done, thanks to Chief Justice Roberts' Supreme Court decision, is reduces all from free citizens to cowed subjects, whom the federal government can order around in our own personal lives in defiance of the 10th Amendment and all the other protections of our freedom in the Constitution of the United States. These are not my words, ladies and gentlemen. These are Thomas Sowell's words. Freedom lost. Religion. The Department of Health and Human Services submitted a final rule making on the state health insurance exchanges that created yet another accounting shell game, one that could force private citizens to pay for the coverage of elective abortions. Time out, wait a minute. We have a U.S. Constitution, and Amendment 1 clearly states, Congress shall make no law respecting the establishment of religion or prohibiting the free exercise thereof. To compel a man to furnish funds for the propagation of ideas he disbelieves or abhors is sinful and tyrannical. Privacy. Centralized computer records. Government-controlled health care gives the government everyone's medical records. Everyone's. Your medical records will not be private. The language is not in the law. It is in the Federal Register, which gives it the force of law. The authority comes from HIPAA, which allows release of patient records without consent to other agencies for other activities necessary for the oversight of the healthcare system. Healthcare, as dictated by the government, also directs the IRS to share confidential personal tax returns with the exchanges and other government agencies. Think about this for a minute, ladies and gentlemen. The two things most Americans consider very private and very personal is the state of their physical health and the state of their financial health. Yet both of these records will be mixed in a database in Washington, D.C. for any government clerk to look at any time they want to for other activities. You have no reasonable expectation of privacy regarding any communication of any data transmitted or stored on this information system. That, ladies and gentlemen, is right off the official government website. But you won't find it on the home page. You have to go to the source code to find it, but it's there. Question: is there a chain of accountability? If so, who's accountable? Internal Revenue Service? Well, we all know how the Internal Revenue Service holds their employees accountable. It is the IRS who will make sure all taxes are paid and will also determine who is eligible for taxpayer-financed subsidies. Anytime anyone's situation changes, a raise, a new job, a move to another state, that person will be required to report it to the IRS for purposes of recalculating their eligibility. George Orwell's 1984. Has fiction become reality? But no one has put this better than Ben Stein. Fathom the hypocrisy of a government that requires every citizen to prove they are insured, but not everyone has proved they are a citizen. And now, any of those who refuse or are unable to prove they are citizens will receive free insurance paid for by those who are forced to buy insurance because they are citizens. Question: the Democrat Socialist Party will make socialized medicine a key part of the 2020 presidential election. Therefore, it is very important to ask some basic questions. Who is in control? That, ladies and gentlemen, is a question that should be keeping you awake at night. Who is in control? Here's a table of organization and chart for Obamacare. Can you imagine when the government controls every single aspect of medical? Section 6301 establishes a patient-centered outcomes research institute. Establishment: there is authorized to be established a nonprofit corporation to be known as the Patient-Centered Outcome Research Institute, which is neither an agency nor establishment of the United States government. And that, ladies and gentlemen, is word for word right out of the law. Here it is, 21 pages, just this one section, with paragraphs in it containing words like subpopulations, clinical effectiveness and appropriateness of medical treatment, which is neither an agency nor establishment of the United States government. Who's going to hold them accountable? Quote from the official Democratic Party talking points on government-controlled healthcare, and I have them right here, ladies and gentlemen, and the cover letter is signed by Nancy Pelosi. Question: I have heard that under the healthcare law there is a panel that can order my doctor not to give me certain procedures, therapy, or care. Bureaucrats will decide whether I live or die. The official Democrat response: there is no such panel. This is a blatant falsehood. Section 6301, Patient-Centered Outcome Research Institute. That's got a clunky name and it kind of lacks the panache of the English system, which is nice. National Institute for Health Clinical Excellence. But make no mistake, ladies and gentlemen, these two boards have the exact same job: to determine quality adjusted value of life. Obamacare is like a cancer to Americans' freedoms. It must be cut out before it metastasizes into socialized medicine. which simply means all citizens become property of the state. If the government controls your health care, the government controls you. England's National Health Service decided Charlie Gard, a 10-month-old, should die. Decided Alfie Evans, a 3-month-old, should die. Legal challenges by the parents failed. In effect, the courts ruled the patients had no rights. These children were property of the state. Question: do you want a bureaucrat, any bureaucrat, deciding when you die? Watch out for the public option, Medicaid buy-in. These are all ways of getting around and bringing in socialized medicine. Here is kind of a comical look at socialized medicine. You can see where the doctor has a stethoscope. But there's an article by Dr. Jeffrey Singer who put socialized medicine into context in a one-page article. And I want to read you just the middle paragraph of that article. In other words, we are about to experience the two-tiered system that already exists in most parts of the world that provide universal coverage. Those who have the financial means will still be able to get prompt, courteous, personalized, state-of-the-art health care from providers who consider themselves professionals. But the majority can expect long lines, mediocre and impersonal care from shift-working providers, subtle but definite rationing, and slowly deteriorating outcomes. Ladies and gentlemen, I would not like to see that ever happen in this country. But unfortunately, it's already started. Don't believe it? Pay attention to all the mergers in the medical industry, insurance companies, hospitals, pharmacies, growing number of minute clinics in pharmacies. In the last 4 years, there has been a 60% increase in physicians employed by hospitals. What that means, ladies and gentlemen, is that is 165,000 physicians no longer in private practice. Pay attention to all the states that have removed all restrictions on abortion. Pay attention to all the states that have passed laws or are considering laws for doctor-assisted suicide. Article by Marilyn M. Singleton, president of the Association of American Physicians and Surgeons. Free medical care, a deal with the devil. With regard to medical care, all medical necessary health services, including dental, vision, hearing, mental health, long-term care, home and community-based services, physical therapy, prescription drugs with no premiums, deductibles, or copays from the cradle to the grave. Sounds pretty good. Sold. Frankly, given the direction so-called reproductive health is going, you may never make it to the cradle. And with the current laser focus on hospice for all, you may get to your grave a lot faster. These are necessary steps by the ruling class in order to control who lives, from who is born, to when the elderly have a duty to die. As reported by the Association of American Physicians and Surgeons, death, the only treatment option. Quebec palliative care. Palliative care is what we call hospice. Clinic to be killing center. When a palliative care center in Quebec announced it will not offer euthanasia, the Minister of Health honestly told it, yes, you will. In the UK, patients are pushed to choose suicide over abandonment and unreasoned pain. Simply put, ladies and gentlemen, if you're of a certain age and you have cancer, you have a choice. You can be given a pill to go home and kill yourself, or you can go home and die in unreasoned pain because they will not treat your disease and they will not manage your pain. Some choice. Babies suspected of having Down syndrome in countries with socialized medicine were aborted. United Kingdom, 90%. Denmark, 98%. Iceland, 100%. Do you think all those mothers wanted their babies aborted? No way. Can't happen here. Article in the Albuquerque Journal, May 13, 2018. End of Life Option Act. The Albuquerque City Council unanimously passed a resolution, 9 votes to 0, in support of medical aid in dying. It is now up to the legislature and the governor to make it law. And here it is, ladies and gentlemen, House Bill 51 and House Bill 90. It didn't pass this session. But as they say, there's always next year. The Wall Street Journal, Tuesday, June 18, 2019. Euthanasia and Organ Harvesting by F.H. Buckley. As lawful assisted suicide spreads, some advocates call for a monstrous expansion. Ladies and gentlemen, we could spend hours on this article alone, but I highly recommend you, if you can get access to it, read it. And if it doesn't scare you to death, nothing will. Simple explanation of socialized medicine. The federal government's the single payer. Government-run healthcare takes medical decisions away from patients. The faceless single payer calculates the value of your life based on benefits to society. The single payer determines what treatments are necessary and appropriate for you. Can anyone say quality adjusted value of life? Your medical care will be provided by younger, less experienced physicians, non-physicians, probably, possibly, no one. In what order is the money distributed? Some money will trickle down to those who help patients, but 40% or more may be siphoned off en route. 40%? The single payer pays. Administrators, rulemakers, compliance officers, auditors, first. Medical professionals, second. And a lot of medical professionals call this rubber money, because if you didn't dot your I's and cross your T's, they'll get it back. Someone must pay for it, obviously. There is almost universal agreement the cost would be $32.6 trillion over 10 years. That is over and above what the government now spends on medical care. Ladies and gentlemen, we're $22 trillion in debt. What country spends the most on medical research? The United States, because we have the free enterprise system. France, Germany, and the UK, well, they just kind of pick up what we come up with. But they don't always pick it up because it might cost too much. Cost control, single-payer system. The National Health Service sharply restricts access to treatments. Hip and knee replacements, cataract surgery, arthritis, diabetes. Gee, I wonder if that has anything to do with your age. The Daily Mail, April 8, 2019. Thousands of elderly are losing their sight as NHS rations cataract surgery. January 3, 2018. The New York Times, hardly a right-wing rag, says the average emergency room wait is 12 hours before the patients are attended to. This is referring to the National Health Service. Everyone must get health care. Yeah. Single payer does not guarantee a right to health care. Under the National Health Service, not everyone gets health care. However, here in America, because of the free enterprise system, the best medical care in the world can be found. Let me say that again. The best medical care in the world can be found. Solutions. Let's talk about some solutions. The American people taking personal responsibility for their own health care. That, ladies and gentlemen, is a must. Medicine that is free of government intrusion and protects the sacred bond between doctor and patient. Eliminate third-party payers. Get the government out of it. Get your company out of it. Make the doctor be responsible to you because you're paying them. Make the insurance company responsible to you because you are paying the premiums. Question: why is Costco and IKEA so popular? The business model is very, very simple. You eliminate the overhead and profit of a third party. i.e. no warehouse or distribution costs. Goes directly from the manufacturer to the stores. Something to think about. Salaries for CEOs of the 5 health insurance companies. There's 5 of them listed. The total is $94.7 million. That's $94,700,000. That's salaries. Doesn't count stock options, bonuses, and it doesn't count all the huge infrastructure, desks, employees, everything that goes with insurance companies. And you and I are paying every single penny of that. Question: when you put gas in your car, you fully expect to pay. When you have a meal in a restaurant, you fully expect to pay. When you go to Costco, you fully expect to pay. Why is it that when you go to a doctor in hospital, you expect somebody else to pay? Why is that? So what, if anything, should the government do? If at all possible, we need our government to adhere to the KISS principle. Keep it simple, stupid. Good luck with that one. Simply put, only 3 things are required. 3 things. I could write the healthcare law on 1 sheet of paper. 1, 2 health savings accounts. Money put in an account for payment of medical expenses, only medical expenses, no taxes at all, not even payroll taxes. 2, true catastrophic insurance. Insurance that covers only major illnesses like cancer, heart attack, stroke. Number 3, all medical expenses taken off the top of your income. Right now, ladies and gentlemen, you only can deduct medical expenses that are over 7.5% of your adjusted gross income. But yet, if you own a Roto-Rooter franchise and you send your employee to the car wash to get the truck washed, every single penny of that cost comes right off the top. Why? Because it's the cost of doing business. Maintenance of the vehicle. Ladies and gentlemen, most of us do business with our bodies and our mind. If we're sick, we can't do business. So every penny that we spend to maintain our bodies and our health should come right off the top of our income, just like corporations. The key: the HSA and the catastrophic insurance policy belong to the patient. If the patient changes jobs, the HSA and insurance policy goes with them. Therefore, pre-existing conditions are no longer an issue. Realities. How do we realistically end up with a workable solution? As a nation, the following question has to be answered. Is it the job of the federal government or the government at any level to ensure every American has health insurance? No solution is possible until that question is answered. If the answer is yes, be prepared to turn over your decision on your health care to the same people that run the post office. TSA, IRS, DMV. Because after all, ladies and gentlemen, a bureaucrat is a bureaucrat is a bureaucrat. If the answer is no, be prepared to take personal responsibility for your own health care. Catastrophic health insurance, health savings accounts, 0 taxes on money spent for medical care. In other words, freedom of choice. Free to choose your doctor, your health plan. As the saying goes, and this saying is as old as time itself, he who pays the piper calls the tune. And that, ladies and gentlemen, is just as true today as it was in medieval times. If the insurance company pays the doctor works for the insurance company. If the government pays the doctor works for the government. If you pay the doctor works for you. Let me ask you again. Do you want a bureaucrat, any bureaucrat, deciding when yours or any unborn baby should live or die? Or when you should die. If the government controls your health care, the government controls you. Remember, under socialized medicine, every citizen is property of the state. The American people have voted away their freedoms in exchange for the promise of free medical. It only took 2 generations from what is commonly called the greatest generation. Ladies and gentlemen, thank you for your time.
It is your responsibility to look beyond sound bites and stay informed on what is really happening with healthcare. As you can see, if you only listen to sound bites, they can come back to bite you quite inappropriately. Your elected representatives should know your name because they hear from you constantly. Support politicians who understand freedom, because that's what we're talking about. The difference between being a free citizen and property of the state.